Peace and welcome back to the Trailblazing Dark Matter Studios, where I uplift and educate my community and, by association, the world. I am here taking your hand by the ear to float you some positive affirmations and information for overcoming and dealing with a stroke. No one is immune to needing medical interventions at some point in his or her life. Our bodies are as fragile as they are remarkable. Whether you've had a hemorrhagic stroke, a mini stroke, or an ischemic stroke, you are capable of becoming much stronger than you are now in this moment. You are not alone. Don't give up. Feel the emotions that arise and don't forget to breathe. If you've had a stroke, this means that there is a blockage in the delivery of blood flow to your brain. Now, during a mini stroke or transient ischemic attack, also known as a TIA, blood flow is temporarily impeded. This slow in blood flow causes stroke-like symptoms that clears up once blood starts flowing again. Arteries are the main highways of the blood delivery system from the heart throughout the body. A buildup of plaque in any of the arteries or blood vessels can put you at risk of experiencing an ischemic stroke. Another type of stroke is referred to as a hemorrhagic stroke. This can come about when a blood vessel or artery bursts, flooding that area of the brain with blood. The blood collecting there is toxic to the brain tissue, so these cells begin to weaken and die. What does this mean, you might ask, for the rest of your body? Depending on the location of a stroke in the brain, that will dictate what part of the body is affected and how severely. Your mind and body are working in overdrive to repair any damages from this sudden medical emergency. Be patient with yourself. Give yourself grace. Be also patient with the individuals around you at this time. Take it easy. Monitor your stress levels. The brain sends all the neuroelectrical messages to the body in order for it to function the way we want it to. A blockage or interference in the brain prevents these electrical messages from being transmitted properly. So certain body parts are not going to respond the way they used to. Expect that your body will return to homeostasis. Be determined and sharpen your will. Sort through any doubts you may have and think only triumphant thoughts for your healing. If your speech has been affected, calm your mind. This is known as aphasia. Aphasia signifies injury to the left hemisphere of the brain where language comprehension and speech production lives. It's important to note that this is a loss of language and not intellect. That ever-present mental voice is your higher self still guiding you through life. You will be able to form your words again with practice. Recall yourself speaking just as you did before your emergency. Hear your voice singing the song that touches your heart, or rapping those deep lyrics that inspires you to be the change you want to see in the world. Day by day, it will be easier to find the proper words to express yourself again. Visualize and feel your tongue being placed in the proper position to form the words you're looking for. When your speech is affected, your swallowing can also be altered post-stroke. The pipe we send food down, the esophagus, is intimately close to the pipe that supplies our lungs with oxygen, the trachea. Most people have felt this connection by inhaling drops of water, then constantly coughing, right? During your recovery, you may be required to drastically change what you usually eat so that you don't aspirate. This is a vital part of your recovery process. What you put into your body can energize your cells and organs to heal, or it can do the opposite. The most severe complication of a compromised airway is silent aspiration. When the sensation in your throat has weakened so, your brain doesn't receive the signal to cough and clear your airways of blockage. This allows food and or water to build up in your lungs, preventing airflow. Focus on your goals. You will succeed. You are safe and secure. Frequently remind yourself that you are strong enough to do this. When you're feeling overwhelmed, take a deep breath. This alone can bring you instant relief. While recovering from a stroke, you may be experiencing paralysis on either side of the body, or just weakened strength. When you are ready, physical therapy will train your body to regain the function that was lost. Until you're ready to practice safe physical therapeutic movements, try mental exercises. Tell yourself positive affirmations with your inner voice. I can overcome the obstacles ahead of me. I have patience to deal with the changes my life is going through. I can do this. I am healing. This body still belongs to me. I care about my health and well-being. I am ready to make healthy choices for my healing. My faith is as strong as it's ever been. I cannot be broken. I will walk again. I will talk again. I will eat again. My pain will go away. This is only a phase. I am taking intentional steps to heal my body, mind, and soul. You are doing amazing. Give yourself grace. Regaining full mind and body connection will take time. Allow your mind to talk to the weakened body part to positively encourage appropriate function and movement. You may feel weighed down like a rock on the weaker side of your body. Using your stronger side to aid the weak side promotes in rehabilitation. By keeping your afflicted side propped up on pillows, this helps with circulation. Don't allow yourself to neglect or forget about your non-responsive side, even if you feel it's forgotten about you. Imagine that left arm reaching up and gently caressing your face. See in your mind's eye that right hand grabbing your phone or gripping someone's hand to say hello. Picture your toes curling on both feet. See your foot flexing up and down to the beat of your favorite song. Use your imagination to see your leg bending at the knee with no resistance. Replay these movements in your mind's eye, regardless if your body responds or not. Your mental exercise is just as important as your physical. Pain will sometimes accompany most strokes. Just as chronic inactivity in life can put you at risk of a stroke, inactivity can also worsen a stroke. All stages of your rehabilitation are important. Breathe through any waves of pain you may feel during this process. You are doing the best you can in this moment. Moving too fast can lead to injuries that prolong your healing, so take your time. You are all different in mind, body, and spirit. Allow your family and medical staff to help you. Give yourself time to feel the emotions that come with having a stroke, whatever they may be, so that you can deal with them in a healthy way. It's okay to communicate with the people around you that you may need a moment with your emotions, or you just need to take a break. We often as humans turn our sadness into anger, which deprives us of the healing power of tears. Let your sadness, anger, frustration, helplessness, and pain flow out of your body through your tears. You are not alone. You aren't the only person going through this that has recovered from this, and you won't be the last. There are people who can relate to your situation, and there are people who cannot relate. Find strength in both of these realities. You are working hard to bring your body back into balance, along with your healthcare team. You and I in this moment are working hard to create balance and peace back into your mind. See your greatest outcome for the future, but remain in the present moment. Release your attachments to the things you cannot change. They can become shackles. Give your energy to that which you can change. Try not to compare your situation to anyone else's. Your body is unique. Remember to take care with your emotions. It's okay to need time to be alone, to be overwhelmed. You may find that you are stronger than you thought. You will be able to do things you once said you can't. So before you say, I can't do it, give it a try. If you fail, that gives you a chance to try again when you're ready. Be encouraged to try new things during this time recovering from your stroke. It's difficult to do all the right things to try and prevent having a stroke, but there are some easy things you can try, like learning about a stroke, for instance. Knowing is half the battle. Increase your knowledge on the topic of stroke. When dealing with an ischemic stroke, for prevention, what you put into your body is essential in building your defenses. It's important to eat raw and natural foods as often as you can. This provides the body with vitamins and minerals it needs to stay in homeostasis. Our veins and arteries work non-stop to keep our blood flowing smoothly and purposely to every part of our body. Cheap, fast, and processed foods can build up and cause blockages due to the ingredients they contain. Our genetic makeup is so amazing that we can eat potentially toxic foods for years before our anatomy shows signs of decay. If high blood pressure and sugar imbalance affects multiple people in your family, examine the food you all share. Traditions can bring a lot of joy to families as well as detrimental habits. Most conditions that are thought of as hereditary can be eradicated by simple change in perspective. We must honestly examine our underlying issues and gain an understanding in order to deal with them. Some people can relate to eating their favorite foods to cope with stress or pain. Unfortunately, this stress response doesn't make the problems go away. Along with unhealthy eating habits, stress is a top cause of stroke. Statistics and a plethora of books provides evidence that highly melanated people are at a higher risk of stroke than those who are less pigmented. These people include the indigenous people of America, Hispanics, and the African diaspora. These various melanated nations of people must eat and live more consciously compared to the mainstream lifestyle of America. Remember, while you're recovering from your stroke, you are the most powerful person you know, because only you can enact change in your life to heal.